communities taking charge of their health. Well, Calvin Allen, this is something you know a lot about, isn't it?
Well, I've learned a lot over the past 4 years, getting to work with a lot of different communities through the Healthy Places North Carolina initiative.
Tell us a little bit about the challenges rural communities face in terms of healthcare access and health outcomes.
Well, certainly in terms of access to care, I mean, you're covering the gamut. I mean, one is just being more spread out, getting to healthcare facilities is a big issue. And sometimes it's not within the county boundaries. They don't mean as much in rural communities. I may need to go over the border to get kind of what I need from the health center that's closest to me. So that's one issue. And then also, of course, the economics of, a lot of us get our health care. I get my health care through my employer, and when those employers go away, when the big businesses go away, the manufacturing goes away, there's a need for alternatives for that. So a lot of folks are trying to figure out, how am I going to pay for my health care? And of course, there are people on all levels, whether it's local, state, and federal, that are working on that in different ways. But there's a lot of local innovation around that.
So, talk to us a little bit about the local innovations because,
Yeah.
quite frankly, the challenges you express feel very daunting. And certainly, as we see more and more consolidations
Mhm.
of providers, we can only expect that there's going to be fewer in place providers going forward. So, how are communities responding to this?
Yeah, and especially with specialty care,
Yeah.
it becomes, do I have to drive to Chapel Hill or some larger place to get my needs met? A lot of it really is, and this sounds overly simple, but you'd be surprised that just people coming together to brainstorm is really one of the best things that we've seen across the state.
I'm not surprised.
Yeah. Well, people locally, as you've seen, people locally coming together, and that's one of the things I get to help with my team and the Healthy Places North Carolina initiative, that we get to help local providers come together with not just the people who are working on health in terms of formal health, but also thinking about the social determinants of health. So the sheriff is at the table, and you get DSS and the superintendents who are all there together talking about what is it that we need and what is it that we can provide. And one great example is where we saw that there were a number of behavioral health groups, different people meeting to address behavioral health in this one county, and recognizing that they didn't know that several people from the same organization were attending different meetings. And so the community got together and figured out kind of what are the key needs. They're now sharing case management. These different organizations that were all going to the same household can now share the same case managers and reach people in that way.
How much are you seeing technology play a part in the response to these challenges?
Telemedicine is one of the bright shining opportunities that's out there in terms of somebody being able to look at a computer screen and still have access to good health care, that they are talking to a live person who can address the issues and the needs, and that it is somebody that they know, that they have a relationship with this person. Of course, there are still challenges that come with that, because cultural competency becomes really important. And
What does that mean?
well, in terms of, there's a community where a local hospital noticed that a lot of the Latino folks in the community were not coming to their hospital, even though it was closest. They went to another one that was 20, 30 minutes away, because they were focusing a little too much on kind of on technology and doing telemedicine, that folks wanted a personal touch. So balancing out technology with kind of the needs for safety and access in that way.
I am really impressed by the community forums in McDowell County, in part because of the breadth of people who are taking part in those conversations and the resulting breadth of areas for innovation that stem from a conversation that began about health. Do you see this happening a lot in North Carolina?
It really is. You know, people don't often have the opportunity to really just sit down and address what's going on. And that's the power of the West Marion Community Forums and now the East Marion East Community Forums and Old Fort Community Forums. They're growing there. And across the state, what we're seeing is that with a little help, that people are willing to come together to kind of look at what are the issues, what are the impacts, and brainstorm together what are some innovations, what are some things that we can do. But it really takes leadership, and that's the really key piece, is having folks say, why aren't these people at the table? And noticing that they're not at the table, and reaching out to local community voices to find out kind of what's really going on, just beyond the surveys that happened around the community health needs, but instead really kind of hearing what's core. And then having a little bit of help with some facilitation and some folks to help take notes and show best practice and help them kind of identify what are particularly some national models that can be implemented here, and beyond that, who are the folks who are already in our local community making a difference, and how can we amplify that to a county-wide scale?
I'd like to draw a line of demarcation, if I could,
Sure.
because you suggested that communities engaged in this kind of bottoms-up focus on health really need two kinds, or benefit from two kinds of expertise. One is around just helping the community group have the conversation they need to have. That's facilitation. It's helping them identify stakeholders who may be missing, strategies for getting those people in the conversation. That's really the process side of things. But then you started talking about best practices and helping communities be connected to resources around innovations that respond to the challenges they raise. Am I getting
Absolutely.
that correct? Where do communities in North Carolina get either set of supports?
Well, that is part of the work. The KB Reynolds Charitable Trust initiated this Healthy Places North Carolina program in 2012, identifying 7 rural counties, and with a goal to see their major health indicators improve over the next 10 years. And they recognized that as part of that, they needed somebody to kind of help those local leaders, to help them do what they do better, kind of amplify their impact. And so the organization I work with, Rural Forward North Carolina, was created to kind of help with that. And so in one county, the community came together and they said, you know, we have several different school systems. Let's bring them together and come up with a curriculum where we can talk about healthy eating and teach the students that, and they can take it home as well. And they knew that there were some curriculums out there, so we were able to do a little bit of research and kind of bring them a couple of different models, and they looked through and made a decision about what they wanted to use. And they're using the coordinated approach to child health, or CATCH, in Halifax County, which is making a big difference there, and bringing these different school systems together, as well as helping the young people there as well.
So, what happens to communities that are not fortunate enough to be in the Healthy Places program? Are they places they can go online to get some of the resources they might need?
Yeah, absolutely. I mean, I think in terms of number one, folks are always welcome to call us, and we'll share the resources that we know about. But additionally, one of the things, you know, early in our process, we wanted each county to come up with their own ideas and not just replicate what the other county was doing. But 5-6 years in now, we're recognizing that a lot of the communities are coming up with some similar ideas, doing it in their own way. And we're now starting to bring people together for statewide meetings around behavioral health or healthy eating or active living, and looking at, well, you did it this particular way and you included these folks when we didn't include those folks. Why did you do that? And they're noticing some kind of core elements that make the program strong. And so we're documenting those things, and they're sharing. They're using that to kind of advocate that here's an example of good policy that other folks can use as well. So that's kind of the next step as we're moving forward.
Talk to me a little bit about evaluation. How should a community evaluate its successes around this kind of comprehensive, conversation-based process?
Yeah, twofold. One is you have to have data. And we always start there. So first is, in terms of this is an issue or a need, let's find out what the data actually says about that and kind of ground truth it with real conversations. And I think that's the part too, is that the data only tells so much, that you also have to have communication and conversations with the community to say, this is what the data says. Is this your lived experience? And so there have been a number of examples, and the West Marion Community Forums, again, are a great example of, what are you actually experiencing when it comes to this, and beyond just what the data says, and bringing those two things together. So coming up with some outcomes that, number one, show where you want to be. And it really, a lot of our work starts with the community coming up with a vision for how they want change to look in their community. Where do they want to be in 5-6 years? And then, we walk them through, well, what does it take to get to year one? And come up with some solid benchmarks. But then we also hope that they take that back to the community, even after the 1 year mark, to go back to the community and say, this is kind of where we're going. How does this look for you? So it's that constant ground truthing that happens as
And
well.
it sounds as though it's also iterative.
Absolutely.
Got it.
Yeah, because it has to change. You recognize you will start in this one path and recognize that Medicaid expansion is changing in our state, and that may impact kind of our goals. So let's look at that again. Or Hurricane Florence comes through, and there are needs now that we didn't anticipate, and we need to take that into account. So let's change our plan to accommodate that as well.
Calvin, share with us one innovation that you have seen that just got you dancing when nobody was watching.
Oh, there are a lot of great examples. Again, as simple, we were just talking about data, and as simple as it sounds, when a broad group of community members recognized that they were duplicating services, reaching out to some of the same communities, that they were able to create an agreement. And this sounds strange, but this has not happened. I think this is one of a kind.
Doesn't sound strange.
Yeah, that to share information, and you'd be surprised. So, for example, imagine that you had gone to the hospital and for something urgent, but you had also just had some tests done at your local doctor, and there are these questions that medical professionals have about, can we share this data? And people are not clear about that. And so once that issue was identified, a group of community leaders came together and figured out, how can we legally figure out how to make all this happen? They came up with something called an organized healthcare agreement with the help of some statewide entities, but it was driven by local innovators who made this happen. Now, this is a model that can be used across the rest of the state and the rest of the country.
We've been talking about the opportunities of this kind of intensive work at the ground level to identify the challenges and then to determine the best responses for that community. Let's look at the flip side, because this is hard work.
Yeah.
I know that, you know that, right?
Right.
When a community decides that it wants to have this forum-based stakeholder engagement process, what are the things they should worry about?
The things they should worry about. I think, number one, having enough time. I think, how do you package the entire needs of a community into a 2-hour session? So I think taking it bit by bit and allowing for several conversations, that if you run out of time with the first one, that you're planning for the second one, and that the first one is done anticipating there may be a need for a second one. I think that's first and foremost. Secondly, I think it's really important to recognize that we don't often allow for emotion. And so my passion for my community should be yelled in the streets. And sometimes people come to meetings and they've got a lot that they have to say. So making space for that, and having some help. You know, I am a facilitator, and so I believe in the power of third parties who can help folks kind of take care of the process part so that you can say what you need to say and not worry about that, but somebody to help with that.
I think I hear you saying this is not for the impatient or for the faint of
No,
heart. Not
yeah,
this kind of process.
not at all.
What about building relationships within community? One of the things that struck me with the McDowell Community Forums is how much time they've invested in building the right relationships and how much benefit they seem to have derived from those relationships, even beyond
Yeah,
the intended purpose.
yeah. I I think one of the great examples is the local city council, after attending the community forum, saying, this is a great venue for us to have our meetings so that people can have direct conversation with us about kind of what they're seeing, what they're needing. And so I think that is another way of um, moving from, I'm hearing what people saying, I'm showing up at these meetings, which is really important. And I think for folks who are in formal leadership positions, recognizing being there and showing up matters to community. But then beyond that, thinking through what about this work that I can take on as well, and kind of learning those lessons beyond it.
Kelvin, what have I not asked you that you really want to share with viewers?
That there really is power in connection, that we have a lot of boundaries out there in terms of, I work in the health field, so why do I need the school superintendent here? Or this is my community and our boundary is here and your community is over there. So recognizing that we have to have ways to cross those boundaries, because ultimately we are one larger community as we are individual communities, and holding both of those things at the same time is really key and important. And so figuring out ways that we create natural pathways to explore each other's communities and each other.
Thank you so much for being with us.
Thank you for having me.
Thank you for the work that you do.
Thank you.